I'm going to show you how to duplicate the patient's existing artificial tooth arrangement. Whenever you're creating a new prosthesis, communicating this information to the lab can be extremely helpful, even if it's to show what you do not like about the current prosthesis. In front of you are a few things. You'll see capture putty impression material, which we're going to use to duplicate the denture, as well as a denture cup, which the duplication will take place inside of. Now looking at the denture cup, you can see that I've created some retentive elements by simply just adding a couple of drill holes into it. These holes will replace the need for adhesive. We are going to take 3 to 5 scoops of both the catalyst and the base impression material. You're going to go ahead and mix them thoroughly. Once it's mixed, you'll place that putty into one side of the denture cup, pressing it down nice and evenly. Now I'm going to take the denture and place it into the putty cameo surface down, and push it into the pressure material until it's about even with the flange. Once the putty has set, you will then take some Vaseline. You want to make sure to place a nice thin layer of Vaseline over the set putty as well as the intaglio surface of the prosthesis. This will prevent the two sides of the putty from locking together. Now that you have that, you'll once again take 3 to 5 scoops of the catalyst and 3 to 5 scoops of the base, mixing it together nice and thoroughly. Now you're going to add a little bit of the mixture to the intaglio surface of the denture, and then the remaining putty is going to be placed on the other side of the denture cup. You're then going to promptly close the denture cup. So once it's set, you can go ahead and pop it open. Don't be alarmed if the putty comes off of one side. It can be pushed back in. Once you open it up, you can see that you have a nice impression and your denture is ready to be removed. It can then be given back to the patient to wear and go home with. Now you can send the duplication of your denture to the lab, and they can use this information to create the next step for this full arch prosthesis. If you are pleased with the current arrangement, this duplication can help the laboratory create the appropriate plane of occlusion, select the tooth size and shape, and can help with multi-unit abutment selection if necessary.